I want to welcome Lila Massoumi. She's here with us to chat about what she does in her private practice as a holistic integrative psychiatrist in Michigan, and also a teacher, as well as someone who's participating at the American Psychiatric Association in a really wonderful way. So welcome, Lila, and thank you so much for being here to talk with us.
Thank you for having me.
Yeah. So please describe, first of all, what your private practice is about. You call it holistic integrative, and what does that mean to you?
hmm so integrative medicine would be physician-guided integration of conventional medicine treatments with complementary or non-medication ones. Holistic would imply that we also incorporate spirituality into our treatment paradigm, or at least in the back of our mind, even if we're not vocalizing it directly to the patient.
Do you want to say a little bit more about how you incorporate spirituality, or at least open the door to that?
Sure. Well, I know that this is Emma's favorite subject. So basically, the whole reason I went into psychiatry was after I read the book The Road Less Traveled by M. Scott Peck, MD, where he defines love as putting someone else's spiritual growth ahead of your own happiness. And so I became a psychiatrist after having come from a long line of doctors in my ancestry for the purpose of helping souls evolve spiritually. I don't necessarily say that out loud when I'm meeting a new patient. But in the back of my mind, well, first of all, there's sort of the conventional medicine. We do a spiritual history, along with asking 101 other questions unrelated to spirituality. The way we ask about spirituality is, are there any philosophical traditions, spiritual or religious beliefs that in the past or currently have a large impact on your life? So it gives them an introduction. I am more likely to bring it up number one, when there's been recent death or bereavement. There's research from Julie Beischel from the Windbridge Institute that in complicated bereavement, when someone is having now I'm rambling. Okay, so in complicated bereavement, and the second time I'll bring up spirituality is if I've pretty much tried everything and the therapist has tried everything, and the universe keeps bringing certain patterns to the patient, like for example, a long string of bad luck extending years, I might sort of nudge them to look at it from a spiritual angle and that type of thing. So anyway, that answers your question.
Great, thanks.
Okay.
And how do you bring your perspective to the American Psychiatric Association? Because I know you are participating in a caucus there that includes complementary and integrative.
Right. So I chair the American Psychiatric Association Caucus on Complementary and Integrative Psychiatry. We have about 350 members. We have worked with our overseeing body, the Council on Research, on publishing a paper, for example, on SAMe, which is an over-the-counter derivative of folic acid, is probably an easier way to put it. That's been shown highly efficacious for depression. We've also published, as of July of 2017, a textbook through APA Publishing called Complementary and Integrative Treatments in Psychiatric Practice. And we are committed to offering scientific programs at the annual meeting for both conventional psychiatrists and, even more importantly, to the next generation of psychiatrists, particularly the residents that do tend to pass through that meeting.
Fabulous. Very exciting. So I'm thrilled that you're going to be giving two presentations, or we're going to coordinate with two presentations in January. I'm looking forward to that. And would you say what you would like to be covering in terms of one presentation on integrative medicine and another on integrative psychiatry, so people have some idea what that'll be about?
Sure. So I've been involved with integrative medicine since I took a leave of absence from medical school when I was disgruntled by the hypocrisy I thought I was seeing, and re-entered medical school once I discovered the American Holistic Medical Association. I'm one of the early members of that group. And there's been a lot of terminology changes from the 1990s onward in terms of what terms we use to describe sort of integrative or holistic care. And it can get confusing when you're as a layperson, or even not being in integrative medicine, trying to sort it all out. There are also various professional organizations that fall under integrative medicine. By professional, I mean physician groups, and they all have sort of different strengths, I should say. And I would like to help the listener sort that out so that when you, for yourself or your client, are seeking an integrative medicine physician, you have some structure as to how to go about looking for that online.
Oh, that's great. That's great. And so we'll do integrative medicine as well as integrative psychiatry. And what would be the difference with the second one?
Mm-hmm. So in that one, the integrative psychiatry lecture will be based more on the types of things I'm doing in my integrative psychiatry practice and the rationale behind it, what some of the limitations are in terms of evidence base, how I approach patients who come seeking integrative psychiatry treatment, that type of thing.
Wonderful. Thanks. And
sure.
So you and I have decided to do that as a conversation in January. So we'll both be there, but I'm just going to be really asking you questions, I think, to make it more of an interview format. And we're really looking forward to having you participating more at IMHU. We're thrilled to be more connected with you and very excited about the work that you're doing, not only in your private practice in APA, but also in teaching medical school students. So thank you so much for giving this brief interview and giving people a peek into what we'll be doing in January. And,
thank you, Emma. And I also look forward to the questions from the audience members, because that's sort of also what fuels me. So I'm looking forward to speaking to you guys.
Yeah, so we'll probably be doing 45 minutes of kind of a presentation dialogue and then 15 minutes of Q&A.
Got it.
Then after that is done, for those people who can't reach the live webinar, then we'll leave a recording up so that people can watch it later. Okay, any final words before we say goodbye for today?
Oh, I think I interrupted you with the final words, so we're good.
Okay. All right. Thanks again so much, and hope to see you again soon.
Thanks,
Bye.
Emma.
Bye.